Assalamualaikum doctors. In this video I am discussing a video station that is about shingles. It's very common, it common exam. So it is a shingles, it is a reactivation of chickenpox. Remember, reactivation of chickenpox and herpes zoster, and it is a dermatomal distributions. Reactivation of dormant of varicella zoster virus, prodromal illness of the pain in affected the dermatome with pyrexia and malaise, followed by vesicular and pustular rash unilaterally over one or more dermatome. The most common dermatome are lumbar and the trigeminal. And if it is around the eye, we call that herpes zoster ophthalmatica. So my patient, you are looking that around the eye, so we can tell that it is a herpes zoster ophthalmaticus. And another thing I want to share, lumbar region we can be find that it is a cluster like a reactivation of dormant of chickenpox, varicella zoster virus, and it is the description is a vesicular lesion, crusted lesion, pustular lesions. Okay. Then we are going, so it is a case of shingles, which is a reactivation also of chickenpox. We'll tell that. What are the differential diagnosis we can keep? So it can be shingles, it can be herpes zoster, herpes simplex, impetigo, hand, foot and mouth disease, scabies, and eczema herpeticum. So herpes zoster, herpes simplex, impetigo, head, foot and mouth disease, eczema, scabies, and the top diagnosis is reactivation of the chicken pox, which is shingles. So what history would like to ask? The history I like to ask as usual, onset, course and durations usually happen before, very important, before chicken pox, polymorphic rash with different stages, distribution, dermatomal distribution, very painful, itchy, spotty, oozing, painful and not involved nose. Remember, it is a medical emergency. So what happened before? Polymorphic rash with different stages, distribution, that is dermatomal distributions. Is it painful, itchy, spotty, oozing, painful and non-involved nose? Fever, bone achy, feeling unwell, tingling, loss of appetite. Headache, painful eye movement, history of any chronic illness, immunodeficiency. Preceded by drugs, vaccination, abnormal gait. So as usual, the history is like any rash history, onset, course and duration, before what happened important, and the rashes distributions, is it unilateral or bilateral, painful, oozing, itching, these are any chronic illness, what about his appetite loss, immunodeficiency, drug history, fever, headache, painful eye movement, these are. So it is an emergency, you understand. Then examination, what we do for the shingles, examination are first of all examination of the rash including the glass test, general condition of the child, vitals and hydration status, examination of the eye if involved and other mucous membranes, lymph node and abdominal examinations, neurological examination and gait, and chest examination for pneumonia. So examination we are doing ABCD, vitals, especially the glass test, any rash we do that. Then we are doing the eye examination because herpes zoster ophthalmaticus, we know that. Abdomen examination for abdomen examination, lymph node examination, respiratory examination for pneumonia. Okay, these are. So what is the investigation we do? Investigations, it is clinically diagnosed. We take from the history. Management of shingles, mainly first of all immediately refer to the ophthalmology for eye assessment. It is an emergency. Supportive management, mainly we can give the painkiller, medical management, painkiller, acyclovir in the first 72 hours of the rash, 7 to 10 days in immunocompetent and 21 days about 3 weeks in immunocompromised patients. Steroid eye drops after consultation from the ophthalmology. Prevention, vaccination, varicella zoster, immunoglobulin. Advice, stay off the work of school if the rash is still oozing fluid for 4 weeks. So 4 weeks will be school or stay off work. Avoid pregnant people who have not had chickenpox before and babies less than 1 month old. Avoid people with weakened immunosystems. So this is again the management. First of all, we are giving the supportive management. Supportive management like analgesic, antipyretic, antihistamine for itching, supportive take fluid, proper hydration status maintained is very important. Medical painkiller we give, acyclovir we give. What is the treatment? Acyclovir in the first 72 hours for the rash. That is acyclovir 7 to 10 days in immunocompetent and 21 days about the immunocompromised. Steroid eye drop after consultation from the ophthalmologist. So we will involve ophthalmology here must. And we give prevention by vaccination, varicella zoster, immunoglobulin, and we give the advice: avoid pregnant women, avoid babies less than 1 month, avoid immunocompromised patient, and stay off work or school for 4 weeks. So this is shingles, reactivation of the chickenpox, dormant of chickenpox. It is dermatomal distributions around the eye. It is herpes zoster ophthalmaticus. So group of clusters, then we understand. And it is an emergency treatment, and we are giving what is acyclovir mainly, remember. Acyclovir we are giving. Others are supported as usual. This is all about. Thank you.